In this lecture, we're going to focus on the determination of exercise intensity as it relates to cardiorespiratory endurance. And when we think about cardiorespiratory endurance, we're referring to activities that typically involve large muscle groups that are continuous and repetitive. And one example, as we can see here on the bottom right-hand corner of the slide, is a person performing exercise on what's called an elliptical exercise machine. So a person may be on this machine for some protracted period of time, but they're exercising at an intensity level that would allow them to continue exercise for that certain intended period of time. With respect to the particular exercise, this type of exercise is actually independent of any specificity type of training. It is true that this type of exercise is specific to development of the cardiorespiratory system, but in terms of the actual task performed, that's usually not an area of focus with this type of training. As we will see that with resistance exercise, one of the key principles with resistance exercise is progressive overload over the long term, and the same applies to cardiorespiratory endurance. But with respect to this mode of exercise, targeting the cardiorespiratory system, the progressive overload refers to a gradual increase in the duration of the task and or the intensity of the task, not in one training session, but over a period of time, such as, and usually with cardiorespiratory endurance, we're looking at a matter of weeks to months to see that level of progressive improvement. One consideration are the number of days per week with respect to the frequency. And in terms of the intensity and the duration of this particular type of exercise, these terms or these training factors are inversely related, which means that as the intensity of the exercise, so if the person is moving through the exercise at a faster cadence or with greater resistance, the duration in which they would be able to complete that exercise would be lower. So it's not as one increases, the other increases. As one increases, the other one decreases. So exercising at a fairly low intensity would enable the person to exercise for a longer period of time. Now, as it relates to the dosage or the volume of the exercise that's part of a training program. This is not a single training session, but this refers to carrying out exercise regularly over a number of weeks to months. We see that that there is a strong relationship to the improvement. So as a person is exercising, as the dosage is very small, they can expect a very small improvement. But as the dosage increases from a very low level up to a gradually greater and greater value, we start to see this accelerating improvement in performance. So increasing the dosage or volume is going to be very beneficial if the starting dosage is actually quite small. But as we continue to increase the dosage of the exercise training, we see continual improvement, but then we start to see diminishing returns. And so by increasing the volume, the improvements will start to plateau. And the concern here is that the dosage can either be, if the dosage is increased too much in magnitude or too fast, that can push the person into an overtraining situation where physiologically they would actually start to experience a reduction in the improvements and start to see the physiological benefits receding. In determining the exercise intensity of cardiorespiratory or aerobic exercise, there are a number of different ways to approach this, and one common way is to gauge the intensity or try to match the intensity of the work to the heart rate that the person is experiencing when they're exercising. The advantages of using the heart rate method is that it's very easy, it's user-friendly, it doesn't necessarily require the use of any sort of therapist. The person is able to track this themselves, and it's actually correlated with oxygen, with VO2, or the rate of oxygen utilization by the body, and this correlation is highest with moderate to high intensity cardiorespiratory exercise. And so in this case, heart rate essentially becomes a substitute variable for VO2 peak, for oxygen consumption level. It's not perfect. There is some variability with it, but it is a very commonly used and relatively accurate method to gauge that exercise intensity. And the first step in doing this is that the person should first determine what's called their maximum heart rate, or just simply heart rate max. And there are two ways to do this. The first way is to measure this directly during a GXT or a graded exercise test. Now, the second method that we'll detail here in the next couple of slides is the prediction method, or by using prediction equations if a person did not go through a GXT. And these are estimates that are fairly reasonable and fairly accurate. The first equation to determine a person's heart rate max is taking the equation of 220 subtract the person's age. And as an example, if we have a 54-year-old, to calculate this 54-year-old's heart rate maximum, we would just simply take 220, subtract their age of 54, and their predicted maximum heart rate would be 166 beats per minute. The second equation, which is derived from studies that fit regression models to the participants in those studies, has this equation that 208 subtract 0.7 times a person's age. So once again, we have our 54-year-old, and to calculate their heart rate, to calculate this person's heart rate max using the second equation, we just simply first multiply 0.7 and 54, and we subtract that quantity from 208, and we would end up with a maximum predicted heart rate of 170 beats per minute, which is just slightly higher than the first equation. Now, in dealing with patients that are taking a beta blocker medication, once again, here just as a reminder, a beta blocker is a drug that's prescribed to manage a person's blood pressure through reducing their heart rate. So this is a person whose heart rate is not going to increase with exercise to the same degree as somebody not on the medication. And so this equation to estimate this person's heart rate max is 164 subtract 0.7 times their age. So very similar equation that we saw with equation 2. We can't use equation 1 in this case. And so if we take our same 54-year-old and calculate using this equation, we see that this person will be able to achieve an estimated maximum heart rate of 126 beats per minute because medicinally the medication is clamping their heart rate in order to prevent the further increase in blood pressure. Now, to take a look at some of the prescription methods, once we've established the maximum heart rate, either through the GXT or more commonly through one of the methods outlined on slide number 10, we have two methods for the exercise prescription intensity. And the first is referred to as the HRR method, or the heart rate reserve method, referred to as the Karvonen method. This is the first method we'll cover, and to do this, the heart rate reserve must first be calculated. And just as the term suggests, it's the reserve. It's the amount of increase that a person's heart rate can experience above resting levels, and it's basically the difference between their maximum heart rate and the resting heart rate. And so we take, once again, our 54-year-old, and to estimate their heart rate reserve, once again, we'll go with the equation 1 method from slide number 10, and we estimated this person's maximum heart rate of 166 beats per minute. If we know their resting heart rate, and we find their resting heart rate is 64, and this is best measured as soon as a person wakes up in the morning, before they actually stand up out of bed. That's the best, most accurate measure of a person's resting heart rate. So if we have that at 64, the heart rate reserve is 102. So the 102 represents the increase range that a person can experience, in fact, the 54-year-old, from their resting. In terms of determining a target exercise heart rate, we would just take the calculated heart rate reserve, we multiply it by a desired VO2 level, and that's the oxygen consumption level, which is a reflection of the exercise intensity that a person might be interested in. It could be a moderate level of exercise or a high level of exercise, and then we take this quantity and we add it to the resting heart rate. And so with our same 54-year-old, if we want a low to moderate exercise intensity, here I just have low intensity, at a 50% of their VO2 peak, we would just take the 102, which is their heart rate reserve, we put it into the equation, that's what we see here. We multiply it by 0.5, which is the low to moderate intensity, and then we add it to that person's resting heart rate, which was 64. And we find that the target exercise heart rate, if the person wishes to exercise at a relatively lower intensity, the person would target a heart rate of 115 beats per minute. If the person intends to engage in exercise at a higher intensity, and we're defining this higher intensity at 80% of their oxygen consumption level, we still have the same heart rate reserve, we have the same resting heart rate, and we see that the target heart rate to maintain for a particular period of time is 146 beats per minute. So whether it's 115 or 146, the person would adjust the elements on their exercise, whether if they're on a treadmill, they would reduce the workload through the grade of the treadmill or the speed of the treadmill. If it's on a bike, it would be the resistance and the cadence to ensure that and just keep tracking that heart rate until it gets to that target level. The second method is just based upon the percent heart rate maximum that was either measured directly with GXT or estimated. And the values that are typical here could range between 60 to 90% as an example. And so the target heart rate is just simply the person's heart rate maximum times the desired percent heart rate. And so if we go with a low intensity, and if we define a low intensity at 60%, then we would just multiply that by the person's maximum heart rate that we determined from equation 1. And we would be targeting a heart rate of 100 beats per minute. and these are rounded values. If we want to take the exercise intensity up to a much higher level of 90%, then we just simply run the math here in the same way, and we would end up with a target heart rate of 159, which on the high end is higher than what was estimated using the Karvonen method. And this table is a summary of some examples of computing the target exercise heart rate using the Karvonen method or the heart rate reserve method and the percent maximum heart rate. And so in this table here, this follows the same approach that we did here with these equations. It just uses different values from what we used here. So this is a very good exercise to go through in estimating the resting heart rate, maximum heart rate, and incorporating those data into determining what the target heart rates would be at the low limit, upper limit, at 50 and 80 and 50 and 80. So this ends this lecture here relating to cardiorespiratory endurance.